Welcome, everybody. We'll give a few seconds for folks to join in, and we'll get started right away. All right, the number's still going up a little bit. A few more seconds. Okay, I think we're slowing down a little bit, so we'll get started, not to waste any time. Welcome to everybody. This is our 2025 SIM Enterprise Imaging Webinar Series. This is our May webinar, and we will be discussing the benefits of adding cardiology into an enterprise imaging solution. Again, thank you to Sectra for sponsoring the 2025 webinar series. A couple of reminders. This webinar is eligible for 1 hour of the SIM IIP CE that can go towards your ABI SIP certification or recertification. You do have to be on the webinar for a minimum of 45 minutes, and we will add the credit to your account within 48 hours of the webinar completion. Just to make sure that you have your CE, the types of CE that you would like to claim marked in your MySim account. This does need to be completed before the webinar is over. But again, if for some reason you have not done that, you can email us at info@sim.org and we'll take care of that. And for our SIM members who are imaging informatics professionals, we do provide monthly automatic transfer of credits to ABI. Just make sure that you have your ABI ID number and birthday included in your MySim account. All right, and we will have a Q&A session about 10-15 minutes prior to closing of the webinar. So make sure that you put any questions that you have to our panelists in the Q&A, which can be found at the bottom of your Zoom control panel. And with that, I am very happy to introduce our moderator for today, Ms. Brooke Incontrera, Vice President of Marketing at Sectra. And Brooke, I'll turn it over to you.
Thanks, Anna. So I am honored to introduce our 3 experts today. First, we have Dr. Janice Feather, Director of Medical Imaging with Niagara Health. We have Bjorn Limber, who's the Global Product Manager for Cardiology at Sectra. And then we have Wes McLaughlin, who's the Supervisor of Imaging Informatics at Niagara Health.
Right, I think it's over to Dr. Feather.
Wonderful. Thank you. And good afternoon from Niagara Falls, Canada. So I thought I would start with situating people in our beautiful region and then why this work matters. So we have the privilege of living in an area that has one of the natural wonders of the world. We can see a lot of tourists and it is so fun, but also tourists get sick and they need imaging. So we see all sorts of folks in Niagara that we have the privilege of supporting their imaging needs. We are also a beautiful wine country. So if you want to live or work here, please feel free to send me an email after. But this really is such a beautiful area of the world to live in. And I'm just so honored to be a part of this really great organization. And we actually are a very large community-based organization. So we have 5 acute care sites, 3 satellite sites, and some of them are there. We're doing brand new builds. It's a really exciting time in our infrastructure. And we are also an academic center that focuses on really high quality community teaching. And so that'll be really important too, just as we talk about all of that good work and the end users of the Sectra solution, which is just wonderful. And our team in total is made up of over 7,300 staff, physicians, volunteers, and students. So a large team to change manage, and loving that we get to talk about change management as part of this solution. And one of the things I want to note specifically, because we are looking at cardiology, is that we are a regional cardiac center with interventional cardiology. We know that cardiac imaging is so part and parcel to that work. And so having that high quality diagnostic cardiology component to our work is really important. So we are a busy team. Annually, we see over 400,000 radiology exams being completed. And we're seeing like almost a 4 to 5% growth every single year in that that volume. So maybe even our forecasting might have been a little bit off with Sectra originally based on our growth potential, but I love that we're growing. And then in terms of cardiology across all of our cardio diagnostics, we do about 120,000, but we are seeing, again, really significant demand for this work, both from an inpatient, a critical care, and an outpatient perspective. So it has been really, really rewarding to see this program continue to grow. So that's a bit about us. And I just want to have a quick disclaimer before we begin. I have the incredible responsibility of sustaining our beautiful Sectra solution, but my colleague Wes was the really fundamental leader that led a lot of this work. So we're going to be talking and sharing our knowledge together, but just really appreciating that, gosh, we wouldn't be here today without Wes and his amazing work for this portfolio. So thanking you for that. So looking at our team, we have, again, over 600 physicians, and we know physician management is a little bit challenging, and then all those different specialty groups on top of it. And so we do have a combination of about 30 radiologists. It is a rapidly growing radiology group, and 15 cardiologists. And one of the unique parts about us is we are a pediatric, we do provide pediatric services, but we are not a designated pediatric center. And so we actually also have pediatric cardiologists that support some of our solution remotely as well too, through a satellite opportunity. So it is really exciting that we have a growing number of people, but it's also really hard to get everyone to have a consensus. So it'll be fun to talk about that a little bit more. We also have over 250 techs that support acquiring the images. But I would be certainly amiss to not point out that we have so many people, but then our back end is so small, right? So we only have 3 imaging informatic professionals that support all this really important work. So just want to continue to advocate that they really are the glue that holds a lot of our structure together, and I so appreciate them. So this one is really exciting. And Wes, I'm wondering if you can kind of tell us our historical journey about some of the decisions that were made during our procurement and kind of what that process looked like.
Yeah, thanks. So we started down our PACS journey. We had a legacy PACS environment that supported solely our radiology environment. And when the decision came to, as an organization, to add cardiology to the fold, we were able to leverage that single archive or same archive to support cardiology, but with applications focused more on their requirements. That was done in I think 2006. Cardiology came on board 2010. And then, as things progressed, as an organization, we came to the realization that, it had fulfilled the needs of the past. Let's try and find a solution that fulfilled the needs of the future and growing. So we, went down our RFP process. We engaged various stakeholders throughout the hospital. And each kind of highlighting their own specific unique needs and requirements. Cybersecurity from an IT perspective, operational efficiency, given that we do have a smaller team, and keeping in mind the fulfillments of the cardiologists in the cardiology department, as well as some of the needs of radiology. And throughout the RFP process, landed on a commonality, which led to the partnership that we have today with Sectra.
Excellent, thank you. I think one of the wins too that if I could, Wes, that I think your team did a really good job when we looked at this was that concurrent engagement with cardiology and radiology leaders and having the cardiologists actually involved in solution finding with us. I've worked with so many different physician groups over the years in informal leadership, and certainly you get those people who are highly engaged, and it always works better from a change management perspective. So I think that was actually one of the really strong wins to the work that you guys had had. And I think that one of the risks of that, though, is that it's really hard to build consensus between different physician groups, right? And be able to see the vision and do the requirement building in small user groups, and then scale that up to a formal decision from the organization. So certainly that was part of the risk identified with this selection. But I think one of the other one was resources as well too. So some of that consultation also takes more time to get through this process when you're looking at change management and having a really comprehensive rollout plan. But I am so thankful that they were all on the same page. So tell me more about that. So how did you kind of work with both user groups to kind of really build that consensus?
Yeah, so we actually sat down with each group individually and compiled a list of, like I said, their individual needs and wants, and we formalized that through our RFP process. And throughout that evaluation, in turn, we then reached out to those individual groups and provided a demo of the solution for each of them, and then through our scoring process, landed on a common theme, which ultimately led to our current partnership today with Sectra.
Wonderful, thank you. So moving to the next slide. So I think at the end of the day, why Sectra? So I have to be super honest. We have just been so incredibly happy with our relationship with Sectra and really continue to look forward to that roadmap of alignment that Sectra has with our organizational goals. It works strategically, it works pragmatically and operationally. And in our experience, I think it was so clear from each of our groups, so from cardio, from DI, from our enterprise, and then also from IT and other partners, that Sectra was the solution. And I'm really, really thankful for that consensus. But I think part of this work too is that we have realized that we also retrospectively made such a good call. We are so happy with the solution. And I think part of it too is that opportunity to continue to build and learn in the solution together concurrently as we continue to see new opportunities for growth and for optimization of the solutions. So one of my favorite things to talk about is change management. And it's also sometimes the hardest thing. Sometimes selecting the solution is actually easier than change managing it. So Wes, would love to hear kind of some of the thoughts about how you led that with the team.
Yeah, so we throughout that process, and again, because we did have a large involvement from various stakeholders, managing the change, because they were involved from the very beginning, what was somewhat, I guess, less painful than what it may have been. One of the challenges that we did run into, however, is the fact that doing this through the course of an ongoing pandemic led to severe communication fatigue throughout the organization. So that was one of the lessons learned that we had as a takeaway was, how do we alleviate communication fatigue throughout the organization in managing that change? Now, given the fact that we are spread out geographically, some of the tools that Sectra had to help with the implementation were tremendous. We were able to leverage a lot of the e-learning resources that were available through Sectra. Now, specific to cardiology, because they did have some more specific demands, we did also have in-person training with the implementation group from the various stakeholders with Sectra, both from the imaging side as well as from the reporting aspect, to ensure that we continued with capturing those requirements, so the specific requirements from the cardiology group. Given with structured reporting, each site, I guess, could be a little bit different in how around specific customizations that they may have, and the team was great in helping with that.
Amazing, thank you. And then going to the next slide. I think one of the other parts too, Wes, that you were such a great leader in was just looking at partnering with our IT colleagues. And I think so many times imaging informatics professionals kind of run into some of those barriers depending on your organizational structuring. So can you tell us more about that?
Yeah, so we were, I guess, early on in our process. So organizationally, we weren't quite ready to make the leap to cloud. So with Sectra, given the infrastructure solution that was presented to us, it there wasn't a lot of extra moving parts. So it fit in extraordinarily well with the current IT infrastructure that we had in place. So IT did not have to involve any additional vendors that they may not have already had relationships with, given that Sectra is a software only provider. So, managing that change and given the fact that one of the strengths of Sectra is in IT security. Checked off a lot of the various checks and balances that our IT team had, given the the sensitivity around cybersecurity with the current landscape of technology, and especially healthcare.
Wonderful, thank you. And I'm wondering too, so do you want to talk a little bit about just our hybrid environments and remote reading and kind of how that was part of this work as well from a benefits realization perspective?
Yeah, and that so when we went through the early part of our identifying some of our requirements for a solution, that was actually one of the important elements for our cardiology group was that they see the benefits of the radiology team and what they're able to do both in internal to the hospital as well as external to the hospital. And that is really I guess one of the nice things or benefits of this is it doesn't really matter what their role is. The functionality is the same. So whether you're a cardiologist, you have the same functionality to work remotely as you do on site. All of those same tools and features are accessible to them in their home offices or remote locations. Um, yeah.
Excellent, wonderful, thank you. So going to the next slide. So I think when you look at the scope of the work, the total implementation was larger because we were doing basically a big bang, but it was also really exciting to do that work concurrently. So as you can see, there was significant investment in change management up front, and some of those challenges, but also pooling of resources for change management, which was certainly very, very helpful in the long run. I think it also helped our prescribers who are end users of the reporting element to kind of understand and to change manage with us in terms of their expectations and being able to look at what that looks like. So it really was enterprise wide that we made this change, and everyone was on board, and it was just so much easier to do that work. Although it was probably a nightmare for US to do a big bang project like this, I think we saw the immediate positive impact for you and your team. And do you want to tell us more about that?
Yeah. So from a support perspective, um, it's simplified in that it's one solution. So you're not having to leverage one set of tools to support one element of the environment versus another. It's the same environment. Same spot to go to, whether you're configuring new devices or new users. And that's really what I appreciate the most with the solution. And as well from the IT perspective, it's one single environment. You're not having to worry about any significant integration challenges because um, whether you're looking for incompatibilities and whatnot, it's the same ecosystem. So from that perspective, it's nice. Um, Yeah, that's all I
Mhm.
can really touch on at this exact moment.
Wonderful. No, I think that's amazing. And then looking too at that long-term element as well. I think, one of the complex problems that we're trying to work on right now is really looking at how do we already take really effective processes in radiology and scale them then across to cardiology. So it also creates that really lovely dynamic of us being able to pilot small things and learn and grow from them in a really collaborative way. And take, for example, one of the things that we're actually working on right now is our critical result process. So we have a really robust critical result process for radiology, and I really appreciate that. But we identified a gap that, that process actually was never extended to cardiology. I'm not entirely sure why, because I am relatively new in this portfolio. And so we had the opportunity then to look at what is working, how can we scale and spread, and how do we partner with Sectra as we're scaling and spreading to be able to do this work. And so I think that's where it has been really rewarding, is looking at commonalities and differences between how we end up using our Sectra solution and then growing from those. So in terms of I would say one of the other long-term benefits of this is that we're capturing data in a really meaningful way, where we don't have a number of different platforms that we're trying to pull data from to make a meaningful dashboard or to piece together the story of performance. But we actually have that all as easily accessible, and to be able to kind of work together with our teams as we're doing this work. And one thing that I think is also really important is that under my leadership, I have both medical imaging and cardio diagnostics. So we get that opportunity then to kind of marry the teams together, because we're all the same end users of the same solution, which has been really great for collaborative team building across my department, which I really, really enjoy. And then one of the benefits that I think I value the most of Sectra is just looking at the how might we discussions. So, hey, we have this operational problem, perhaps other users or other clients have a similar issue. What's been done in other sites, and that collective learning that you get as benefit from being a part of this type of solution. And I really, really value that work. And I think it's really actually helped us solve a couple of different problems. And we know we can continue to kind of leverage some of that continued partnership over our duration. So we're really, really excited. And then lending itself to the next slide, I think one of the things that we might do differently if we were to do this again, or if we could advise you, depending on where you're at with your journey through this work, is really looking at the importance of that first experience with the solution. And the first experience of the solution being in a demo environment, not during a go live. Unfortunately, Niagara Health had a recent experience of a large solution that we didn't really see fully until the day they turned it on, and it wasn't great from change management. So we really appreciate that Sectra engages really actively as a partner through that implementation process, but also looking at the timing of that with other organizational and competing demands at times. And so really timing it out intentionally, because this work is so important, but it also deserves the attention that it gets. And so ensuring that you don't have that significant competing demands that may limit either the success or the rate at which you can implement this work. And then I think one of the things that Wes and I are still actively working on is also right sizing. So it's so exciting when you can add point of care, you can add a whole bunch of different other options, but are you actually changing your informatics team at the same time to keep up with that growing demand as you continue to scale your Sectra solution? And so that's one thing I wouldn't say we necessarily have right yet, but it is certainly a tale that I would love for you to all be aware of, is that we continue to kind of advocate for right sizing our team as our solution continues to grow. Wes, anything else from a lessons learned perspective?
No, I think you touched on them all.
You survived it though.
Yes,
You're better
yes.
for it.
And I wouldn't change it a thing, actually, aside from maybe not doing it during a pandemic.
Amazing. I'm sure a lot of people feel, the same way about their weddings and all that fun pandemic stuff that we all went through. And then finally, looking at kind of where we're going next. So on the next slide, you'll see kind of where we're going. So again, we do certainly have aspirations of transitioning to cloud, to really roll out and continue to scale high quality processes that are working with radiology and moving those over to cardiology. Wes, I'm wondering if you want to talk about some of our point of care work that we're also doing, because it seems like we get a new request every other week.
Yeah, so it is something that we will be engaging with our sector partners on. It is, with the recent completion of a new health information system, it is a challenge or a topic that often comes up is how to deal with point of care imaging, specifically point of care ultrasound. So that is something that we will look to further draft and develop with our sector partners as well as our various clinical stakeholders.
Amazing, thank you. And then for folks who are doing that work, I think there's also just that great lesson learned too, that many times different organizations do their procurement in different ways. And so there's actually times where that there have been ultrasound units that have been ordered for our cardiology program that we find out like 6 months after they've been here. And so really ensuring that our informatics professionals are actually involved in some of the procurement decisions so we can make the right decisions right off the hop in terms of what those integrations look like in our Sectra solution. So certainly that has been some continued work that we have to do with our other departments across our organization. And I think some of the exciting work, my CFO doesn't find it as exciting, but that's fine, is expanding our solution. And so really looking at the way in which Sectra is growing in all of their different modules, and then how is it that we are kind of mapping out our future state and growing with them for this solution. I know there's a number of different opportunities and really appreciating that they continue to invest in learning and growing in that space. And so we continue to see that growth of enterprise imaging and what that looks like, and really appreciate the learning that we all get to do together. And then again, finally, my shameless plug for decision makers on this call is that also ensuring that I have the right number of professionals to do this work, and that they also get meaningful time off and they're not on call all the time, because they really are critical to operations in a meaningful way. So we just really appreciate them and their work, and continue to appreciate our time with Sectra, and looking forward to continuing some of the questions today.
Perfect. Can I have some questions?
Mm-hmm.
Yeah, so first off, like point of care ultrasound, you're definitely not alone in that. I would say I see it. It's not only in North America; it is everywhere. Like the devices are getting so cheap, so easy to use that it is a growing need. And Sectra, we've been working at that for quite a while now. But it's an interesting challenge because it's not only imaging. Like it's so much more. It's about your orders and about your a lot of different points in the value chain that have to be connected to make value there. So it is that makes it tougher from a product development standpoint to get an offer together when there's so many different little moving pieces. But there's good stuff coming there. So that it's good to know that that you have your eyes on that. Yeah, and then I also, Wes, when you talked about cybersecurity, I would like to know a little bit more about that from like I know what our pitch is and our history and so on, but what is your how was your view going into that? What was your view on the Sectra brand as a cybersecurity? Like, how did you know cybersecurity and Sectra go hand in hand?
So that's something I actually did not know in advance of going through our RFP process. It's something I learned after the fact that Sectra actually started as a security company. But just in the thoroughness of the responses. So I for me myself, I was not involved in that particular evaluation or scoring through our process. That was entirely done by our IT security department. But just hearing the feedback and the proactiveness to some of the responses from both teams, right? So the feedback that we would receive afterwards from our IT department, as well as the responses provided by Sectra. And then just, I mean, it's not really a security related response, but just in general from with our solution, and I don't think it's unique to us, but the monitoring solution provided by Sectra. I don't know if anyone recalls the CrowdStrike challenges from a not quite a year ago, but last summer. We were actually tipped off by the Sector monitoring team in advance of even being notified by our on-site personnel, which was very appreciative, because they knew right away what the issue and the challenge was, and were instrumental in helping come up. It wasn't really Sector's issue to resolve, but moving forward to our own resolutions internally.
Fantastic. Yeah, and, like it's great that you say that, and like Sectra monitoring is so good both for us as a company for being proactive when interacting with the customers, and also for the customers to just have a look at how the whole situation looks. I know back when WannaCry was active, we had a similar situation also, that we could be earlier on the ball and we could help out with our UK customers that were suffering severely from that. So it's really important that to keep an eye on everything and help out where we can. So when you transitioned to Sectra, not only for cardiology, but also when you did the big shift, did you notice any changes in uptime and system stability?
So, and that's one of the things I am, I guess, proud of with the transition is we made the transition from a legacy PACS environment to Sectra with zero downtime. Which is not an easy feat, especially with five sites throughout our geographic region. So, and we did it in a staged approach, just knowing that cardiology did have some additional requirements. So we went first live with radiology from Sectra, and then I think it was approximately a month later we went live with cardiology, and that whole transition was done, like I said, with zero downtime.
And it's so common that is the most common use case, that you go live with radiology first and then with cardiology, and then the time between kind of differs. It sounds 1 month sounds very fast compared to other other hospitals, but it's great that you had a good experience with that.
Yeah, and sorry, and just to build on that, you touched on the reliability. So because we did adopt the solution prior to I guess the push towards cloud hosted. So in our sector solution, I guess it would be unique for every customer depending on their own individual needs. But the solution that was provided to us by the solution architects from Sectra, it's a highly available solution. So organizationally, we do regular month-end patches, downtimes, maintenance that done to our environment. And the Sectra solution, I mean, doesn't have to be patched after hours. In some cases, because it is highly available and clustered, it is patched in real time throughout the day, with literally zero impact to our customers. They don't even know what's happening. The only downtime we have, and it's not a Sectra solution, is our VR solution for radiology.
Fantastic. Thank you. All right. So yeah, so one last question from me. So you mentioned the synergy of having cardiology and radiology in the PACS. Like, have you gotten any feedback from the end users regarding how, if they've evolved their way of working when they now have accessibility to both imaging types?
So we do, I don't know if it may be unique to our area, but for cardiac CTs, they're reported by both a cardiologist as well as a radiologist. So just having that flexibility or the ability to compare that with a potential follow-up echo or even a cardiac MR in a future space, is, I know, has been commented by both teams respectively that it's been a benefit to them. And given as well in Ontario specifically, we have a provincial repository or image sharing archive. So I do know that our partners, down the highway that do a little bit more interventional cardiology procedures than us, we share those images in real time back and forth. So if a patient is in our cath lab, and I saw that mentioned in one of the questions that we haven't touched on yet, but so one of the patients could be imaged within our cath lab. We will archive those images, and patient will potentially have follow-up work done at that facility. So the benefit of having it within our existing infrastructure environment allows us to leverage that same archive mechanisms to share with our external partners.
That's great. All right, done with my selfish questions now. Let some more in, and I just want to give a huge shout out. I'm so happy to hear that you are happy customers, and they clearly, it's super clear. And a huge shout out to the Canadian Sectra team for supporting you guys and keeping you as a happy customers. So really happy about that. All right, so questions and answers. Let's go. Should we just go from the top? I can read them out. So which brand of stress treadmill data cards do you have integrated into Sectra Cardio? We currently have GEKs, and it's always a pain point mapping the treadmill data into our reporting templates in Philips ISCV. We experienced this with our previous vendor as well. That was Lumedics.
So when we started our process, Sectra at the time, at least with Canada, I don't think had any official partnerships with from the ECG perspective. So ECG and specifically in this scenario for the stress are not currently integrated within our environment.
And there are solutions for that that are very brand new. So it's also something we can talk about in the future. And then from a workflow perspective, are there any key capabilities that Sectra is not currently providing?
Specific to cardiology, no. So right now, we're only leveraging Sectra for echo and stress echo. It is something we would like to look to leverage in the future, although we are storing our cardiac cath image data within the Sectra solution. It's not reported in Sectra. It's those particular exams are reported directly within our health information system. But that as a future state, that's something that we would like to better integrate within our Sectra solution, because it will support the cardiac cath workflows.
Yeah. All right. Jessica asks, do you currently use Sectra for all cardiology modalities, including echoes?
Yeah. So right now it's just limited to echo and stress echo. And that is reported as well using the Sectra solution. I believe Sectra's, at least in our instance, Sectra's partnered with Ascend for structured reporting.
And Ryan asks, are you integrating hemo and interprocedural documentation from your invasive rooms, like from Siemens Sensis Vibe, into the reporting platform?
So our cardiac cath and hemodynamics is through Philips. So we are storing that image data within Sectra. Currently, from a reporting perspective, that's something in a future state we would like to integrate using Ascend with Sectra.
And then Ryan has another question. Why did you choose to report in Sectra rather than EHR, EpiCupid, for example? So it's Ascend, but yeah.
And we're not Epic customers, so.
And then another question. Are you satisfied with Sectra's ability to add functionality within the time frame needed?
Yeah, and honestly, we didn't have any challenges there through our project plan. A lot of the items were clearly outlined in our statement of work through project, and it was evaluated by all clinical stakeholders. prior to implementation. Now there are some enhancements that we're looking to add in after the fact, specific to peer review. So we're looking at doing like a technologist peer review process across both radiology and cardiology, and as well include peer review for our cardiologists. So right now, currently, we just are doing peer review for radiology.
And what type of cardiology studies? Echo, cath, ECG. I think you've already answered this, but yeah.
Yeah, just echo and cath currently.
So Krista asks, can you tell us more about how you evaluated systems against your current environment to get consensus from your operational IT and provider groups?
So that started very early on in our RFP process. We from the get-go, we included all stakeholders from all areas of our healthcare organization. So we include members from radiology team, cardiology team. We included representatives from our emergency and surgical groups to evaluate the enterprise viewing components of the solution, as well as members from surgical to evaluate any of the templating components, and then members from IT to evaluate the infrastructure and deployment requirements. And that was throughout. So through drafting the RFP, through all of the demos, across all of the various submitted proponents, and it was very clear who the who the best fit was for us.
Yes, and then Joseph asks, Wes, I'm assuming the Ascend SR module supports DSR measurement mapping for adult echo, peds echo, and vascular, correct?
Yeah, and that was coincidentally, specific to peds. We've been asked by some, so we don't have specialists employed by Niagara to support pediatric imaging. We do rely on external stakeholders from our partner hospitals down the road, and we've since been asked after implementing this solution how they can implement some of that functionality in their own organization. So that was nice to hear.
Nice. And then another question, is Sectra using 4DM for cardiovascular quantification, image review, and reporting of SPECT and PET?
We don't do PET imaging, but for SPECT, we're not using provided solutions from Sectra. We're using a third party for that.
But it is an integration that we are reselling. So 4DM is available through Sectra Cardiology. All right. And then Brian asks, is your Sectra implementation on-prem, cloud, or hybrid?
So right now it's 100% on-prem. We are looking at internal strategies to build up a business case to migrate to a cloud hosted solution in the future.
All right, and then so nice presentation, Dr. Feather and Mr. Wes. My question is regarding what 1 or 2 real-time examples you can share with us that you learned from other sites using Sectra. Thanks. Venkat.
So at the time of our implementation, at least in Ontario, I think there was maybe only 1 or 3 maybe existing Sectra customers. And I guess since I've gotten to know them quite well, yes, in Canada, specific to Ontario.
Mm-hmm.
And in the past, Sectra was resold by another company. So the one company that I heavily relied on was call it a day one customer, and it they did not have any negatives at all to share about their relationship with Sectra as an organization, and I can confidently say that that's carried on. we have not had a negative experience at all. It's been a great relationship.
Amazing. All right, another one. Are the cardiologists connecting / reporting using a hospital managed asset via VPN?
Yeah, so we do, given that it is the same solution, same ecosystem that's shared between cardiology and radiology, we're able to leverage the same VPN solution provided by our IT department to support both of those reporting groups remotely. And given that, I think I did touch on earlier that for specific to pediatric cardiology, that is 100% supported by pediatric cardiologists at a remote facility, and they're doing that in real time through our IDS7 client in their remote facility.
Amazing. So do you attribute the lack of downtime for the deployment to anything specific?
Yeah, it was the solution provided by Sectra and the engagement of that team throughout, the solution finding throughout that implementation. So part of the solution with Sectra is to leverage some technology. So we were able to in advance configure that technology to in parallel send to both PACS environments, so that we did not have to go back after the fact. And so we have 153 modalities regionally. And you can imagine with a team of 3 managing that across 5 sites. So, being able to leverage this technology and basically essentially at the flip of a switch is to say, all of the image data now goes to this environment was tremendous.
It's very cool. And then Joseph asks, how is the performance when accessing images remotely? Any latency challenges with imaging streaming?
It's actually been really good. And I know it's hard to um, uh, put any specific concrete data beyond that, but the general feedback from our radiologists as well as the cardiologists has been nothing but positive. And given, the variable that comes with remote access, because you've got several layers that go along with that, right? You've got your imaging solution, you've got your hospital network, you've got your hospital's external connection to the internet, and then as well as the radiologist or cardiologist at home situation, whatever that happens to be. So I mean, there is some ownership level that relies on them to make sure that they do have a good, solid connection to the internet. But beyond that, it's been tremendous.
And it is really tricky. Like we have that in cloud conversations all the time. How do you secure users' performance? Because you're gonna hear when people are upset about that right away. So no news is usually good news when it comes to that.
Yeah, and I think what's helped specifically with our group as well, given the I guess finer look or from an organization we've given to security, we do not allow unmanaged devices connecting to our environment. So we are very specific in the equipment that our remote users are using to connect to our environment. So they are all managed by our IT department. So it helps I guess ensure a specific a quality of service level.
Yeah, and that's perfect. Like everyone needs to think about what you let into your network. That's I really like that. All right. So another question: what kind of criteria do you use to weigh the need to do a PACS software upgrade? Also, if cardiology wants a feature but radiology side doesn't, who wins? It's a very good question.
Yes, and that is a challenge. I mean, thankfully, when we went through this specific evaluation, both teams were in alignment overall in the evaluation process. And given that specific to cardiology, We did decide to implement a structured reporting solution for them. I've seen other organizations, I guess, kind of just steer their cardiologist to use the same dictation environment that the radiologist is using. But we organizationally decided to do what's best for them from that regard. Yeah, that's all I can say about that.
Yeah, yeah, I totally agree. Like reporting for radiology and cardiology are miles apart. So you need to take a conscious decision when looking at that, and you shouldn't force cardiologists into the radiology corner.
And if I could just circle back a little bit. So when we started our RFP process, we were at a stage with our current environment that we organizationally we had to do significant investments. So we were either going to maintain our existing agreement with the current vendor and have a very significant capital investment on upgrading hardware, upgrading servers. The current software levels that we were at were not I guess, future friendly. They were only validated to use on Windows 7 at the time. And, that's, again, one of the things that I appreciate and our IT team appreciates most is with the forward thinking of Sectra with that regard. So we're actually currently, one of the benefits I like that I touched on this with a different group was we have scheduled upgrades with Sectra. So we know, uh, the same time every year is our upgrade window. And we know that so we can plan around that. We know what's involved from both a department level for what's in it for us as well as what's in it for our IT team and what their responsibilities are. And given that there was I guess a current technology that was in use by Sectra for client deployments that Microsoft is depreciating. With the next release of Sectra that we're moving to, they've already eliminated that from a deployment model. So they're already ahead with of the curve, I guess, for what Microsoft has depreciated.
Yeah, and the collaboration with Microsoft is just expanding. We've been partners with them for quite a while, but it's working out great, and we'll, especially with going to a public cloud offering, having them as a partner is good. Not like especially from a security standpoint. They are miles ahead and are thinking like culturally also thinking very much the same as us. So it's a very good thing. Great. So Ryan has another question. Do you report on non-invasive in Sectra, but not for invasive?
Yeah, so we just report the echo and stress echo. Currently, we do not leverage the Sectra solution for our cardiac caths, but it is something that we are looking to engage with. It's an external group, so we engage with that department as well as our Sectra partners.
Karen is asking, are you planning on integrating EKGs?
Not currently. Sectra solution will fully support DICOM encapsulated ECGs within the solution, and I believe has a partner, a very good partner on an ECG solution, which I wish was in place when we initially made our selection, but
Yeah,
that's something we'll have to address in the future.
yeah, and I would say it's a common problem that and I really liked what you said, Janice, in the beginning also about getting involved from an informatics standpoint in the RFP, because EKGs is one of those things where to be able to make it work in a PACS like we've done with the new integration that we have, the EKGs have to be DICOM. Like PACS talks DICOM, so we can have DICOM encapsulated PDFs for EKGs and Holters, and that's fine. But to do it fully, it needs to be DICOM waveforms. And then most modalities don't, or a lot of the newer modalities provide DICOM waveforms, but it's kind of a generational shift. So all of the older stuff is proprietary formats, and that doesn't really work. So it's kind of I think there will be a tipping point when it's so natural that everyone just looks at their EKGs in packs. But yeah, technology has to, or the modality vendors have to catch up when just people want to have all of the stuff in the packs. So customers need to put some pressure on the modality vendors when they're purchasing that equipment to say, you should have DICOM or we won't buy. And then this will all figure itself out. But yeah, it is, things are happening fast sometimes, and it's just been, I think, a year since we released the new web-based EKG integration. So it's not strange that you haven't seen it, but it is great. I can promise you that. It's just that you need DICOM EKGs.
And I will say maybe too, to close that one off, is that we are starting an enterprise-wide procurement of new EKG solutions. So I think once we get the right solution in place, and that's where I think what Wes is so helpful to even inform our medical device strategy for RFPs as well, right? Because you need to have that up front and called out to actually get a better solution.
Yeah, 100%. All right, we are rapidly running out of time, but we can take some more questions. So Derek is asking, what is Niagara using to report other cardio modalities outside of Sectra, or using standalone systems?
So we're not using any standalone systems. So anything currently for stress, ECG, Holter, we are that's reported directly within our health information system and cardiac cath. With the exception, I see that the next question, I think from Jessica, mentions around pacemakers. We are using a third party for pacemaker interpretation.
But maybe Wes, to that point as well too, I think our cardiologists would prefer to report though in Sectra, and they're not happy with their current solution with their HIS. So we are looking actively at solving that problem, because cardiologists like to complain rather loudly.
Yeah, and I would like to also touch upon that last question about the EKGs. Like in general, the strategy for Sectra cardiology is that we are we want to stick to the imaging background that we come from. So when it comes to the non-imaging disciplines within cardiology, that has a lower priority than getting a solution that just covers the daily needs of the imaging part. So you can't do everything at once. So that's a decision that we take in, that we should have good support for all of the basic the daily needs for the imaging parts. And then when we have that, we'll start looking at the non-imaging needs. But it's a very good question. All right, Trevor asks, what specific strategies did you use to engage and secure buy-in from key stakeholders across the different departments for the integration of cardiology into the enterprise imaging solution? How did you address any initial resistance or skepticism from stakeholders about this integration?
So I can say from our original implementation, when we onboarded them into the existing legacy environment, it was great at the time because they were moving from an analog process into a digital process, and as they got to use that digital process, I think specific issues and challenges for them arose that were clear that it was no longer going to work for them. So when we made the announcement that we were going to replace our existing legacy environment, we made sure that they had a voice at the table from the very beginning, and we gathered all of their requirements and jotted them down, both from the technologist perspective as well as the cardiologist perspective. And then they made sure that they were involved throughout the evaluation process, both from imaging and from the reporting aspects. And then once we had came to the realization that we were going to form a partnership with Sectra, we went back to those stakeholders, and the Sectra workflow specialist, as part of the project, came back to those stakeholders, gathered what their current state was, gathered what they would like to see in the future, and we made sure that that was implemented with the Sectra solution going forward.
Perfect. So that was our last question. I'll hand it back to Anna, I think.
Yes, and thank you so much. Thank you for all the great questions. We will actually share the remaining questions with the team here. So if you guys posted your name in there and not make it anonymous, then you might be receiving a response via email. All right, just a quick reminder to help us plan for the webinar and also to receive your credit, please complete the survey that will pop up at the end of the webinar. It's just a few questions, really short one.
Anna, I think you're on mute.
Oh no, I'm sorry.
No
All
worries.
right. Reminder about our next month's webinar on June 17 in this enterprise imaging series. Make sure that you mark it in your calendar for 12 p.m. Eastern Standard Time. And I want to thank our wonderful speakers, great Q&A, great discussion presentation. Thank you to our attendees for your questions and have a great rest of the day. And we'll see you on June 17th. Take care, everybody.
Thanks. Bye.